In today's healthcare setting, healthcare professionals are expected to have knowledge and skills that meet a diversity of patients and conditions. It's important that healthcare professionals have knowledge in clinical examination techniques for all systems of the human body, as well as the special examination skills needed for newborn, pregnant, or geriatric patients. Current and future healthcare professionals must be able to demonstrate anatomical knowledge, communication skills, and professional clinical behavior with all patients in all healthcare settings.
That uses the senses of sight, hearing, smell, and touch to detect health problems. There are 4 techniques used in physical assessment, and these are colon inspection, palpation, percussion, and auscultation. Usually history taking is complete inspection. It's the use of vision to distinguish the normal from the abnormal findings. Body parts are inspected to identify color, shape, symmetry, movement, pulsation, and texture.
Inspects the eyelids and eyelashes. Inspects the positioning and alignment of eyeballs in eye socket. Inspects bulbar conjunctiva and sclera for clarity, color, and texture. Inspects palpebral conjunctiva. Inspects the lacrimal apparatus. Inspects the cornea and lens. Inspects the iris and pupil. And also tests pupillary reaction to light.
It involves use of hands to touch body parts for data collection. The nurse uses fingertips and palms to determine the size, shape, and configuration of underlying body structure and pulsation of blood vessels. It helps to detect the outline of organs such as thyroid, spleen, or liver, and mobility of masses. It detects body temperature, moisture, turgor, texture, tenderness, thickness.
Palpation. Palpates the head for consistency. Palpates the temporal artery for tenderness and elasticity. Also, palpates for temporomandibular delicate nodes. Start at the pre-auricular node, the post-auricular node, occipital node, the tonsillar node, submandibular node, submental node, the superficial cervical node, posterior cervical node, the deep cervical chain node, and lastly, supraclavicular node.
It is the technique in which one or both hands are used to strike the body surface to produce a sound called percussion note that travels through body tissue. The character of the sound determines the location, size, and density of underlying structure to verify abnormalities. An abnormal sound suggests a mass or substance like air, fluid in an organ or cavity.
Percussion. PER causes for diaphragmatic excursion by asking the client to exhale forcefully. Percussing at the scapular line T7, intercostal space. Percusses for tone above the clavicles.
Auscultation. It involves listening to sounds, and a stethoscope is mostly used. Various body systems like cardiovascular, respiratory, and gastrointestinal have characterized sounds. Bowel, breath, Heart and blood movement sounds are heard using the stethoscope. It is important to know the normal sound to
Auscultates for breath sounds. Normal. Bronchial, bronchivesicular, and vesicular. Noting location. Auscultates for adventitious sounds, the crackles, finer coarse, pleural friction rub, wheezes, sibilant, or sonorous. Notes the location in the chest wall when adventitious sounds are heard.
Abdominal assessment. Inspect the skin, noting color, vascularity, striae, scars, and lesions and rashes. Wear gloves to inspect lesions. Inspect the contour of the abdomen. Look across the abdomen at eye level from the client's side. Inspect the symmetry of the abdomen. Inspect the umbilicus, noting color, location, and contour. Inspect abdominal movement, aortic pulsations, and/or peristaltic waves. Using the diaphragm of a stethoscope, auscultate for vowel sounds, noting intensity, pitch, and frequency. Start from the lower right quadrant, moving to the upper right quadrant, then to the left upper quadrant, and then to the lower left quadrant. To auscultate for vascular sounds, use the bell of the stethoscope. Start from the same location and move in the same direction as you did when you auscultated for vowel sounds. Now let's move on to percussion. Percuss for tone and then percuss for liver. To percuss for liver, start at the top of the liver and move down to the midpoint. Once you reach the midpoint, move to the bottom and then percuss upwards. The sound should go from tympanic to dull. Now percuss the spleen. Place your hand over the spleen and percuss the approximate location of the spleen. Then have the patient inhale and tap again. The sound should be tympanic. Now let's move on to the scratch test. The scratch test is used to approximate the location of the liver. Perform blunt percussion over the kidneys. Then perform blunt percussion over the liver. Palpate the umbilicus and surrounding area for swelling, bulges, and masses. Palpate the aorta. Palpate the liver, noting consistency and tenderness. Use bimanual palpation if necessary. Palpate the spleen, noting consistency and tenderness. Palpate the kidneys. Perform light palpation, noting tenderness or masses in all quadrants. Perform deep palpation, noting tenderness or masses in all quadrants. Use bimanual palpation if necessary. Now let's palpate the urinary bladder. Now perform the shifting dullness test. Do this by moving your finger from the middle of the abdomen to the side. The sound should always be tympanic. Next, perform the fluid wave test. Now perform ballottement test. Do the same for both knees. Perform the following tests for appendicitis. First is the rebound tenderness test. Next is the Robsing sign test. This is the psoas sign. This is the obturator sign. Perform the Murphy sign test for cholecystitis.